injecting, like we inject discs now. That's one of the new things. I've been doing it about 8 years now. But if you inject disc tears, like angular tears, we inject them with a combination of bone marrow and PRP, both of them highly concentrated. So I can get about 1 cc inside the disc without a lot of fuss and without distorting the disc too much. And so it doesn't have to be a big volume. We found we put too big a volume in, the disc got a little bit too angry and frustrated and stressed.
It's a pressurized system, and you're increasing the pressure in it, it's going to bounce back.
Right. Yeah. So we found that if we highly concentrate our recipes and only use about a cc to a cc and a half, that we don't bloat the disc too much. And so those patients are doing fabulous. And that was unheard of 10 years ago, the idea that we could actually treat a disc from the inside out. Now I do that every week with people. It's a routine to do 2 or 3 discs and just put stem cells and PRP inside the disc. There's studies right now that show bone marrow that works. There's studies that show that PRP works. We're among the few right now that just says, I don't know what's going to work better. Our experience has been that the two combined work better, and so we just put them both in there. But there aren't any good studies yet combining both of them, but that's going to be the future. When that happens, they're going to say, hey, that works better than either one alone.
Yeah, I've spoken to some physiatrists recently, and their ears are perking open because there's been so much, I don't want to say anecdotal evidence, but case studies, cases, colleagues in the physiatry world, pain management world, that their ears are perking up, that this is a solid option. And no longer is it voodoo, it's actually practice, and then collecting those outcome studies over time will kind of solve that. But it's interesting, you guys are ahead of the curve there, and a lot of my colleagues in pain management and physiatry are now like more accepting of, or we can't do steroid, it's not a surgical candidate, they're definitely not, facet injections or radiofrequency. Let's go after the discogenic mechanism there. So. Right.
I do want to make a comment. This is a bit of a segue that matches up. So what are stem cells? What are people calling stem cells? Well, stem cells in America are going to be bone marrow concentrate or maybe fat-derived stem cells. Those are both considered legit. The FDA has been a little questioning about that, but they're pretty happy with bone marrow from everything we can tell. The kind of stem cells that people are being told are stem cells that are not stem cells would be some of the amnion, placenta, birth product types of things. And those, this year, the FDA came out pretty strong and basically said those are not legit. You can't use them anymore. They're not. They haven't been approved by the FDA. They need to get approved. They need to go through the proper drug licensing channels. So if you hear about stem cells and somebody maybe not getting better, but what they got was amnion and placenta, in reality they didn't get stem cells. There's no living stem cells in any of those products. So they were being a little deceptive. Some would say very deceptive.
Yes.
The Federal Trade Commission now considers that fraud. So if anybody says we're going to give you stem cells and they're not using your own fat or your own bone marrow, you are not getting stem cells.
And I think Doc brings up an important point. That was actually going to be my next question: is does it anger you or agitate you when you hear the word stem cells? It can be a potpourri of who knows what you're getting, and I think he kind of answered that question there. So, Doc, I appreciate your time. I'm going to have you turn this over to you. Closing thoughts for our audience, our listeners out there, providers like myself, average patients. What are your closing thoughts on the topic? What do people need to know? 2 or 3 highlights that you can kind of sum this down for us.
I think the big picture is this is for real. This is not witchcraft and voodoo. In the hands of a proper professional who has proper equipment, proper training, it can be done extremely safely. It can be done in ways that don't require to be knocked out in a hospital. You don't have to be sedated for this. My patients are generally very wide awake while we do all these things, maybe with a little laughing gas if they want that, or a little Xanax. But it's not torturous, it's not scary, it's very, very safe, assuming you're in the hands of somebody who understands good sterile technique. We're not growing tumors. We're not making weird things happen for people. It's very safe in our experience. So we're dealing with something that's safe. The insurance companies still consider investigational, unfortunately, so you're kind of left to pay for it on your own until they finally decide that it's acceptable or standard of care. But right now, it's still a little bit outside that box. The good news is those of us doing it, being willing to get outside that box, are actually really good at what we do. And so you're getting that. You're not getting a commoditized medicine yet. I think when insurance company starts paying for it, that worries me about the future, in the sense that then anybody who wants to make a buck can start doing it, and they're going to go to a weekend course, and they're going to say that they know how to do what I spent 25 years learning how to do. Now, I do teach all around the country. I've taught down in South America a number of times. So I'm actively trying to get the world, educated about how to do it. But I think you do want to pick your provider properly, pick somebody who really has experience, somebody who knows their way around the block, somebody who's not just figuring it out on a weekend course last week.
Yeah.
But it's here for real. It's here to stay. Insurance companies will eventually start paying for it, but it could be 5 or 10 years. I love being in a field of practice where literally about 85 to 90% of my patients who I see every day are patting me on the back saying, man, my knee feels great. Can you work on my shoulder? My wife needs something. Can you fix my daughter? So that's all day long we're spending seeing people who are being referred by their friends and family because it just works. And because there's really such little negativity to it all. It's just there's a beautiful thing about getting your body to heal itself, and that's really what we're working with. And it can be done in very quick, simple techniques that actually work very effectively.
And it's nice. I've been able to, my hometown of Chicago, shadowing some clinics that did this, and it's great. You walk in, patients, generally speaking, are happy, they're productive afterwards, they're thanking the providers that I saw. Mm-hmm. It's a fun thing to see because people are starting to get their lives back, mm-hmm. and it's probably fun, to have the small part of their journey kind of guided along that path. Well, Doc, I want to thank you. I want to thank Charm for hosting me today. I want to thank you for dropping all this knowledge on myself and our viewers and listeners to the podcast. Where can people find you? How can people get hold of you?
Well, we are here at Charm Austin, here in Austin, Texas, www.charmaustin.com. That website will take you through a lot of information that we put together so you can learn about it, phone numbers, contact points. You call our office, feel free to come in and see us to get an evaluation. We evaluate everybody thoroughly before we treat anybody. Spend an hour taking care of new patients, looking over all the data, trying to make sure that we understand the story and give you good advice. So we're here in Austin, but we do have a hotel next to us, and we have a lot of people.
It's a beautiful area of Austin, by the way.
Thank you.
Very beautiful area.
Many people travel from all over the country, and even from Canada. Before COVID, we had people from all over the place. That's gotten a little bit less, but it's getting back to again. But it's if let's say I'm the best guy out there, maybe jokingly said, but there are a lot of good people. If you're in California, if you're in Colorado, if you're in New York, just hear what we teach you and seek somebody who has similar experience where you are, and you'll be in good hands. If you're in our neighborhood, or if you choose to come here, we're here for you. We've got a largest center within probably 400 or 500 miles around here doing this type of work, and we've had a lot of years of cumulative experience getting good at this.
So come to Austin, see this man, eat some good barbecue, and hang out on our beautiful lakes and rivers. I'm Dr. Dino Pappas. This is Dr. David Harris. We are at Charm. I'd like to thank them. I will put in the show notes the demographic information for Dr. Harris's bio and the Charm information. This is the We Fix Pain podcast. We are signing out. Thanks, Doc.
Thank you.